person. I always say to people, actually, I am a disappointed doctor because originally I wanted to pursue medicine, but that did not end up being the thing that I did. But outside of that, I chose nursing, and particularly mental health, because when I was growing up, I found that a lot of people will come to me with all sorts of problems, even adults, and people that were a lot older than me. And it made me ask myself, what was it that made people come to me with their problems? So the more as I was growing up, I thought, actually, if I couldn't be a doctor and I'm going to work in health, then mental health was an area that I wanted to focus my career in. But once I started my mental health career, the areas that I started becoming more and more interested in were a couple. The first being parental mental health. So I did a lot of work around parents who develop mental health problems and how we can support parents to be able to do their parenting work, because let's face it, we're all parents, and sometimes we know that actually parenting is one of the hardest jobs and can impact on your mental health. And similarly, if a child has mental health problems, then it can impact on you as an adult. So that's an area that I was particularly interested in and was able to do some work around that. I did my dissertations in those for both my first and second degree. But whilst I was doing that, I then became more and more interested in young people's mental health, and for all the reasons that I have stated earlier, because these are their formative years, and if we don't maintain their mental health or their health overall, then it has huge implications for their life. So yes, I spent my last 5 to 6 years as a practitioner doing early detection and early intervention of psychosis and working with schools, universities, and communities to really detect early.